Hi guys, thanks for stopping in to check out this video. My name is Pierce and I will be the narrator of this podcast called A Sarcoid Journey. This is really just to get my own story out there and maybe build a community of Sarcoid warriors, but just a quick disclaimer that I am not a medical professional. It may take a bit just to get the proper format of the podcast out there, but we're just starting out, so there's plenty of time to figure this out. This first episode is just an introduction of what sarcoidosis is and a little story of how I came to get a diagnosis. If you have any questions, requests of topics or ideas to help the channel out, please use the comments. It would also be awesome if you could like, share and maybe subscribe to the channel to get the story out there and make people aware of what sarcoidosis is. Sarcoidosis is a rare condition that causes small patches of red and swollen tissue called granulomas to develop in the organs of the body. It usually affects the lungs and skin. Sarcoidosis can attack other organs of the body. These immune cell clusters or granulomas mostly commonly form in the lungs, skin and or lymph nodes. It's much rarer for them to occur in the heart, but when they do, the inflammation may damage or disrupt the function or the heart muscles, electrical system, arteries or valves. I myself have been going through tests over the last 2 years to get a diagnosis of sarcoidosis. Sarcoidosis is hard to diagnose and there are many tests that can be performed to try and detect sarcoidosis in the body. During my test, while no one was really sure what was going on with me, I was tested for a wide range of things, lots of different conditions, disorders, but just a few examples are HIV, tuberculosis and Hodgkin's lymphoma. Just to give some background on my own journey, in 2018 I had a cough that went on for a few months and was treated by the GP with some inhalers and never went away. In April of that year I did take a fever which lasted for about 3 weeks, and after the 3 weeks I went back to work. But when I got back into my job I thought I had went back too soon because I was getting tired easily and the cough came back stronger than ever. I had a job in a health and beauty store where I was either putting out delivery or serving customers at the perfume counter. Also around March or April of that year, I weighed around 17 stone, which is about 230 pounds. Over the next few months to June, my body was getting weaker and the cough was getting worse, and literally not able to breathe. In between times there would be massive coughing fit and hardly able to get a breath in between. Because the cough was regular and severe, I would also be throwing up. One night I got sent home from work in a huge coughing fight. I went to the out of hours service at the NE department. I seen the doctor in the out of hours at about 10 p.m. and he was 100% certain that I had pneumonia. There was no shadow of a doubt from him. There was a long wait in the actual NE department and I was seen at 7 a.m. the next morning, and they said that there was nothing wrong and I just need to rest up. I think I was down to about 14 stone at this point. But I guess that's just how hard it is to get a diagnosis of sarcoidosis. The fever was diagnosed as glandular fever, and this is the second time of my life of having glandular fever. The first time led to me having another condition called Guillain-Barré syndrome, which can be talked about another time. But then over the next year the tests began, and some of the tests that I had done are a liver biopsy which found a bubble on my liver, an ultrasound which found scarring on my liver, and my spleen was at a size of 23 centimeters, which is double in size. Some scans like a CT scan mostly came back negative for anything, and a lot of blood tests. A lot. At this time in June, I really had no energy to do anything at all. Even a couple minute conversation with somebody in person or on the phone would tear me out to the fullest extent. Anytime I had to walk upstairs, looking from the bottom to the top, it felt like I was trying to scale Mount Everest. Just sitting on the couch, you'd think I was sitting in a sauna. The sweat was flying off my arms, legs, everything. I can only try my hardest to explain my symptoms. I have pretty much been in isolation for 2 years now, so I was well prepared for the events of this year, but it all blends into one after a while. Also, because I haven't been as social over the last few years, at this point I feel like my communication skills have suffered a lot and my brain isn't as sharp as it should be. This is also a reason why I have started this channel, to get my mind working on things again. From a recent dialogue with my liver specialist, my diagnosis is that I have multi-system sarcoidosis, as it looks to be in my liver and affecting my spleen. I have sarcoid of the skin, which comes out in red blotches like pimples, and also possibly pulmonary sarcoidosis, but I am still waiting on tests with the lung specialist. As with any other illnesses that are to be treated with medication, there are side effects that come along with the territory, especially when you have been taking them long enough. I can get into different side effects in a later video, but currently I am taking the steroid prednisolone. Prednisolone is used in a wide range of health problems, including allergies, blood disorders, skin diseases, and infections, for example. It helps by reducing inflammation. It also dampens down your immune system, which can help in autoimmune illnesses like rheumatoid arthritis, where your immune system is mistakenly attacking its own tissues, which is what sarcoidosis is. One of the side effects of prednisolone is that it can thin your bones out, which is called osteoporosis. So for that, I have been given a supplement of calcium to combat the effects of the prednisolone. Also, I am taking lansoprazole, which reduces the amount of acid that is in your stomach, and is used for indigestion, heartburn, and acid reflux. On a side note, I am taking diabetes medication called Lantus and Novorapid, and also an antidepressant called fluoxetine. These tie in to side effects of sarcoid treatment, so there may well indeed be another episode just to explain how they tie in to my treatment. But now I think it's just time to wrap up this first episode. I hope you've enjoyed this one. Look after yourselves. Love, peace, and elbow grease.